Hi, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to my lecturer, Madam Binti. And for those who are watching this video, I hope you guys in a ping of health. Alright, whether you are a doctor, nurses, or hospital manager, we will likely have to deal with difficult patients throughout our career. While it is really understandable that patients who are feeling pain, lost their independence, or are experiencing stress and anxiety, will sometimes lose control of their emotion. I know it does not make it any easier on us, but you don't have to worry because we have the solution for this issue. So before I continue further with my presentation, I would like to introduce myself. My name is Aina Binti Norazizi, and today I speak about 6 valuable tips on how to treat or manage with patient complaint. Before we go to the tips, first what we have to learn is how to recognize the early signs that patient is becoming upset or angry. So this patient may act including a tightened jaw, clenched face, changes in voice tone, and also changes in facial expression and also their behavior. So what we need to do is, when we meet these people, we must act in a professional manner and also behave appropriately and try to calm down before the situation get out of the control. So let's move on to the 6 tips on how to manage patient complaint. Number 1. Try to understand why they are angry. As basic as it may sound, this is the first and the most important step when dealing with the unhappy patient. Sometimes there are other feelings behind the anger, such as frustration, rage, and more generally, fear, because people sometimes get scared when they get unwell. Although being around a real up patient is no fun, but please avoid yourself from temptation to stay clear and do not argue or pass blame with them, and be sure to control your emotion, because perceived neglect could increase your risk of liability in the current that something goes wrong. And then you have to be sure to give your undivided attention and lend your ear, and then keep your eye contact with them and truly hear what they have to say. And we should spend even more time with them, for instance, to ensure that he or she thoroughly familiar with their plan of health. And then you have to summarize what they have said to you, and they know, because at that time they know that you were listening to them. Remember, our ultimate goal is to retain this patient, not to fight with them. Number 2, acknowledge their feelings. So empathy is a key when it comes to the successfully handling patient complaint. At this stage, it can be useful to demonstrate empathy towards the patient. Essentially, this is the acknowledgement and also the appreciation of someone else's emotion. You have to keep in your mind that this is the patient, and he or she may not feeling well, and also he received an unfortunate diagnosis. So you have to put in the patient's shoes and let him or her know that you understand their frustrations presented in the instance. So besides that, you can tell them some phrases, emphatic phrases, like, given everything you have told me, I understandable that you are feeling that way. Or you can tell them like, it sounds like you have a lot of going on at the moment, and it is natural that you are feeling angry. Or any phrases that show your empathy and concern towards them. Number 3, ask questions. You have to get as much information as possible, but that you can ask some questions to get the information. For example, it's okay, you can tell me more. Why are you feeling this way? Is there anything happened to you that making you angry? so that we can get the detailed information and we can know that what are they angry with. This will best help you and your staff to figure out how to handle the patient complaint and avoid any issue that could arise in the future. Number 4. Explain and take action. Sometimes a patient anger is really cry for help or attention. At this stage, let the patient know that we are taking this issue seriously and proposing them a solution. And don't forget to explain that issue among the administrator, and this will be checked and addressed. Besides, inform the patient that you will follow them up after through the investigation of the grievance. Plus, it is the best practice to have a time frame for the patient to anticipate a contact about the issue. Number 5. Conclude. What you have to do is you have to conclude the consultation by thanking the patient for taking time to speak with you and bringing the matter to your attention. And you also can give some suggestion of a plan going forward that you can often help so that the patient does not feel abandoned soon after being so angry. And formulating some action point going forward helps to acknowledge patient's anger. For example, you will tell them that you will organize a meeting with clinical nurse specialist if the patient is dealing with a difficult diagnosis, or you can advise them that you are going to pass on this information to a senior if the error has occurred. This is very important because to ensure that they understand that their satisfaction is our number one priority. Number 6. Document complaint. At this last stage, you have to formally document your patient complaint, whether it is serious or not. It is important that protocol is in place for dealing with this patient and ensuring that the grievance are followed up internally. And if you promise to touch base with the patient, be sure to do so in a timely manner. There you have it. Unfortunately, dealing with difficult patients just come with the territory when it comes to working in the medical field. However, just because of one of your patients behave disrespectfully doesn't mean that you have to do so. You have to do the same. Alright? Just follow these 6 tips that I have shared with you today, and you are able to handle the difficult patient like a pro. Alright, I think I have to end my presentation here. I would like to thank to you guys for lending your ears and spending your valuable time for watching this video, and I really hope that these tips are really helpful for us when we come across to handle the difficult patient. Lastly, I want to take this opportunity to wish you Assalamualaikum Madam, and always take care of yourself and still obey with government order. Alright? Okay, so stay safe, be more at home, and Assalamualaikum. Bye bye everyone.